Welcome back from that incredible networking session. I hope you had fun, made some new friends, new connections, learned what's going on in Brooklyn, New York City. It was great to see everybody engaging with each other. I love that. We're switching up our afternoon session just a little bit. The order is going to be a little bit different than what we had originally planned. So for that reason, we're going to start our afternoon session with our long-term collaborator and the director at large of our Committee on Plant-Based Health and Nutrition here at Downstate, who also happens to work at the New York City Mayor's office, Rachel Atcheson. Rachel is a unique force in support of plant-based nutrition and sustainability in New York City. She currently serves as the Deputy Director of New York City Mayor's Office of Food Policy, and she previously served as Borough President Adams' Deputy Strategist, focusing on plant-forward food policy in the city by contributing to the establishment of Meatless Mondays in the New York City schools, and the launch, and the launch of the lifestyle medicine programs in H&H hospitals, and other public health and sustainability initiatives around plant-based nutrition. And she's here today to give us an update on all the great work that she's doing with the Mayor's office. So warm welcome to Rachel Atcheson.
Thank you all so much. I feel like we know each other now that we've been through the networking session where I think I sit down with every single one of you. So thank you so much for having me. My name is Rachel Atcheson. I serve under this Mayor Eric Adams. I think most everyone in here knows his health journey, but for those who don't, he actually went into remission with his type 2 diabetes about 7-8 years ago now, and that's why we're here. You know, my office, the Mayor's Office of Food Policy, it was previously an office of 2, and now we're an office of 10, and that's because he has really put his money where his mouth is in terms of food policy, really advancing this across the board. And I have taken about 150 slide deck and I've made it into a 20 slide deck, which means that I'm going to take out a ton of content. So there's a lot of things listed here that I'm not going to be going into today because I really just want to give you an overview of how the city is navigating moving in a more plant-forward direction. So with our procurement process, just to let you all know, New York City has about $300 million that we spend on food across the system. That's in our schools, our hospitals, our jails, our homeless shelters, and our older adult centers. So we spend a lot of money on food, which means that we can actually change some of the purchasing habits that we've had previously to be in a more plant-forward direction. And I'm going to jump to where we serve the most meals, which is schools. So we serve about 1 million kids a day in our school meal process, and that means we have a lot of opportunity for good, but we also have to build on what we've already done. So we already implemented universal school lunch. We already implemented Meatless Mondays. So when we got into office, we started Plant-Powered Fridays, and that is an initiative that the Office of Food Nutrition Services implements alongside wonderful partners such as Wellness in the Schools, such as Plant-Powered Metro New York, such as Coalition for Healthy School Food. There's so many wonderful players in this space, and one of them, Wellness in the Schools, is actually bringing culinary education, culinary training into each school system, into each school, and really training the chefs that are in those schools. We've came up, because of a chef's council, we actually implemented 100 new recipes that we are rotating through the cycle to get students exposed to more plant-based options throughout their career. But it's not just what is served in schools, it is also what is taught in schools. So the curriculum has to sort of match that sort of approach that we have. So we implemented a food education roadmap last June, and we are in the journey of implementing this in the Department of Education, really building onto what does the curriculum look like. By 9th grade, are we learning about marketing? Are we learning about, by 10th grade, are we learning about lifestyle medicine? By 11th grade, are we learning about animal agriculture and the environment? There's just so much that we can do in this space, and we're just scratching the surface. And we're scratching the surface thanks to partners like these who are really going into New York City public schools and educating the students, educating the families, et cetera. So our chronic disease prevention work, Obviously, at our core is our lifestyle medicine work with H&H, but more so because our health and hospitals only represents about 25% of all hospitals in New York City, we have to think, how do we get nutrition education into those arenas of the majority, that 0.75%, that 75% of hospitals that don't have a Dr. Michelle McMacken at their helm. How do we move that needle? So Nate Scherfinsky, on the Deputy Mayor for Health and Human Services team, he's been able, with the American College of Lifestyle Medicine, to move this needle and get nutrition education, a 5-hour training to every New York City public and private hospital. So if you're at an institution who you might not have heard about this, definitely get in touch with me because it is available for every single New York City person in the medical system. So that is through our health and hospitals department. Now through our Department of Health, we have what's called the food standards. For those who are not in the minutia of government bureaucracy, these are actually the standards that every agency that serves food has to adhere by. So the really amazing thing about the new iteration of the food standards that were released last year is that we now require a plant-based protein to be served once a week for lunch, once a week for dinner, in all city-run contracts. So that's in your hospitals, which we'll get to in a minute. That's in your homeless shelters. That's in your jails. That's in your schools as well. So our food standards are one of those bureaucratic mechanisms that are actually really exciting. And our Department of Health has been a wonderful partner at sort of getting out news that we need to eat a whole lot more plants. So we have some nutrition security programs that we have built on the shoulders of that Department of Health runs as well. To wrap up, I will mention that there's a lot of problems with our food system outside of the healthcare space. So obviously today we are laser focused on health, but there is an environmental footprint that comes mostly from our beef, lamb, and dairy. And what we have done is pledge to reduce our carbon emissions by 33% by 2030. How are we doing this? Well, thanks to Chef Phil and Samantha, who are here from Sodexo, we are actually implementing plant-based defaults in all New York City public hospitals, so those 11 hospitals. And we're serving things like this. We're serving delicious meals that we've taste tested and turns out people love. And about 50% of people stick with that option. 50% opt for the meat-based option, but the people who are choosing that plant-based option are actually saving us 59 cents per meal. So we're engaging the private sector. We've asked them to sign up for the Plant-Powered Carbon Challenge. And if anyone here knows institutions who might want to join that challenge, get in touch. I would love to make that connection. And the newest part of looking at our carbon emissions is saying, can we bring a plant-based culinary center to Rikers Island to implement a culinary training? And so we're doing that this September, October. So that is the sort of latest and greatest in New York City food policy. I think I gave out all of my cards today, so I do not have any more, but several people here know how to get in touch with me. If you have any questions, feel free to reach out on LinkedIn, email. More than happy to talk because we have just started to scratch the surface of what New York City has the possibility and capability of doing. But I think it really depends on each one of us as an individual moving that bottle forward. And so thank you for your time in being here today. Thank you for your attention and looking forward to the rest. Thanks, Beth.